Hello and welcome to the first of Health Workforce Australia's quarterly updates. In each of these updates we'll be outlining progress in our four key program areas: planning and research, clinical training, innovation and reform, and international recruitment. One of the major developments in the last 12 months has been the establishment of the Australian Health Professional Regulation Authority. This organisation will collect information on 10 regulated health professions, and Health Workforce Australia will be using this information to develop Australia's first comprehensive health workforce statistical database. This set of information will enable us to plan for future training requirements, future immigration requirements, and will for the first time give us a comprehensive national picture on 10 regulated health professions. Another piece of work that we're doing in planning and research is our macro supply and demand study. This study looks at future requirements for the 30 major health professions out to 2025. Once complete, this will give the information that's needed by governments, by the higher education sector, hospitals and healthcare providers to better plan and invest in the future of their businesses. To do this, we need good quality information, and the National Health Workforce Statistical Dataset will provide that. In November 2010, the Australian Health Ministers requested HWA to undertake Australia's first ever national training plan. The national training plan will look at the workforce requirements for doctors, for nurses and for midwives out to 2025. This will enable governments, university sector, and the public and private providers of clinical training to know exactly how many health professionals they need to train each year between 2013 and 2025 to achieve Australia's long-term goal of self-sufficiency in health workforce supply by 2025. HWA has just completed a $425 million funding round to support growth in clinical training right across the Australian higher education and healthcare sector. We've planned this so that the additional funding flows into the 2011 academic year, and we're just now in the process of finalising agreements with all of our program providers. Simulated learning environments. This is an innovative way to train and prepare health professionals for the challenges of healthcare into the future. We will be commencing a funding round in the first quarter of 2011, and this will encourage a national network of simulated learning environments in the public sector, the private sector, and the higher education sector. Another area of clinical training is our regional training networks. This is a mechanism for bringing together the higher education sector, the clinical training providers in a regional context so that they can plan and manage the business of training health professionals for the future. This program will begin to roll out halfway through 2011, and we're well advanced in the planning at this time. I now want to turn to Health Workforce Australia's Innovation and Reform program. Innovation and Reform is about looking at how health professionals practice, how they work with one another, the efficiency and the flexibility in the way that they deliver their skilled services in the healthcare system. There are two pieces of work that Health Workforce Australia is focusing on at this point in time. The first is the development of a national strategy for health workforce innovation and reform. This will provide the framework to guide future investment in health workforce reform activities by Health Workforce Australia, but also by the higher education sector, governments, and the non-government healthcare sector. Another major initiative is the Aboriginal and Torres Strait Islander Health Worker Program. This program looks at the future workforce requirements of our Aboriginal and Torres Strait Islanders and the skilled workers that will be needed to meet their needs. As part of this program, we'll be undertaking the necessary groundwork to prepare Aboriginal and Torres Strait Islander health practitioners for their entry into the National Health Professional Regulation System in July 2012. A final piece of work for Health Workforce Australia is recruitment and retention of international health professionals. No matter how well we plan, train and reform our health workforce, there will always be a requirement for skilled health professionals from overseas to work within our healthcare system. Health Workforce Australia has been asked to develop a national strategy to support the process of recruitment and retention of overseas trained health professionals, and we'll be working with governments, the higher education system, the regulation authorities and immigration agencies to ensure that our strategy supports employers to find the best workers they need, but most importantly, supports international health workers to come to Australia to assimilate into our healthcare system and to be supported to provide good quality services right across our health system. It's a privilege to lead an agency that's undertaking one of Australia's most important policy reform processes, and I look forward to keeping you informed on our progress.